Hi, my name is Desiree, and I will be performing the Foley Catheter skills video today. So I will begin by gathering the necessary items and entering the patient's room, making sure to close the door as well as the curtain to ensure patient privacy. And I will make sure to place my items on a clean, flat, dry surface. I will go ahead and begin hand hygiene and introduce myself to the patient. Hi, my name is Dezare, and I will be your nurse today. I will also go ahead and verify I have the correct patient using two patient identifiers. And if I can please verify your first and last name as well as date of birth, please. Okay. And I will go ahead and confirm I have the correct patient along with their wristband. Okay. And once I have verified that I do have the correct patient, I will go ahead and inform the patient of the procedure that we will perform today. Okay. Hi, Mrs. Smith. So it looks as though your doctor has placed an order for a Foley catheter today due to some urinary issues that you've been having recently. So I did want to go ahead and let you know about the procedure. So I would go ahead and begin by placing you in a lying flat position with your knees bent and pointed outward. And go ahead and cleanse the area, inspect the area. I will then go ahead and set up the Foley kit. Once that's been set up, we'll go ahead and clean you once again, and then insert the Foley catheter. And now during that procedure, we'd go ahead and appreciate that you do stay as still as possible, and that you do go ahead and keep your hands at waist height, just so that way we maintain a clean and sterile area. Now, if you have any issues throughout the entire process with pain, please go ahead and let me know. And also, if there's, as I stated, any pain, just please go ahead and let us know. And did you have any questions? No? Okay, so I'm going to go ahead and begin. So I will go ahead and begin by donning clean gloves. And now I am dominant in my right hand, so I will go ahead and make sure to be at patient's right side. I will go ahead and lie patient flat in the lying position. So Mrs. Smith, I am going to go ahead and lower the head of the bed just to make sure we have you in a lying flat position. Okay. And then if I could have you bend your knees and open, exposing the perineal area. And then I would also go ahead and raise the bed, making sure that patient is at a correct height. All right, Mrs. Smith. So looks like we have you in the correct position. I am going to go ahead and begin the process of cleansing. Is it okay if I go ahead and touch you? Okay, perfect. So we'll go ahead and grab my items. I do have two towels, one for the no-rinse soap and one for drying. And once I have patient's permission to touch, I will go ahead and begin. Okay, Mrs. Smith, I am going to go ahead and touch you. All right. And so with the no-rinse soap towel, I will go ahead and begin with the labia furthest from me, starting from top to bottom and going in a downward position. Okay. And then I will go ahead and switch corners, and then with the labia that is closest to me from top to bottom. And then down the middle from top to bottom, it will go ahead and clean. And I will go ahead and dispose of the towel in the trash. With the towel for drying, I will go ahead in the same sequence from the labia that is furthest to me from top to bottom for drying. And I will go ahead and switch corners with the labia that is closest from top to bottom. And then switching corners from top to bottom down the middle. and I will dispose of that towel as well. I will go ahead and inspect and visualize for the urinary meatus at this time. I will also go ahead and inspect for any redness, swelling, irritation, or foul odor. Okay, so it looks like everything's good. So I will go ahead and dispose of my gloves and toss those in the trash. I will make sure to go ahead and perform hand hygiene. And at this time, I will open the Foley catheter cup. And with the outer of the kit, I will make sure to go ahead and place that to the patient using this as a trap. And we'll make sure to open the kit. And then we'll go ahead and remove my gloves. And I will go ahead and don my sterile gloves. Now I am right-handed, dominant right hand, so I will make sure to put on my right glove first. And once I have placed on my sterile gloves, I will go ahead and get rid of the packaging since it is no longer needed. And I will go ahead and place that in the trash. Okay. And then I will go ahead and set up my Foley kit. Next, I will begin by opening up the sterile sheet. All right, Mrs. Smith, if you would please go ahead and lift up your hips. I can go ahead and place this drape underneath your bottom. Okay. All right, and then I do have the perineal sheet as well. I'm going to go ahead and drape that over you as well. And I'm just going to go ahead and get the Foley catheter kit set up here. Okay. So I do have the kit set up. I'm just going to go ahead and empty out the alcohol swabs. I'm going to go ahead and take those out and dispose of packaging. And I do have a lubricant here. We will go ahead and place that in the well here and dispose. And I will go ahead and grab the catheter, removing the cover. And then with the catheter, I will go ahead and dispose of the cover. And I will place the catheter in the lubricant that I have exposed. And then with the syringe, I will go ahead and take off the black top, and I will insert it into the balloon catheter area. All right, Mrs. Smith, I have gone ahead and set up for the Foley catheter. I am going to go ahead and begin with cleansing you again. Is it okay if I go ahead and touch you? Okay, perfect. So we'll go ahead and begin. Right? So once I have gone ahead and touched patient, this hand is now considered dirty. So we'll go ahead and take one of the sterile wipes, sterile swabs, and then beginning with the labia furthest from me from top to bottom, I will begin cleansing. We'll grab another, and with the labia that is closest to me, it will go from top to bottom. And with the final swab, I will go ahead down the middle from top to bottom. All right. And without letting go, I will go ahead and grab the catheter. I will make sure to grab 5 to 7.5 centimeters, which is about 2 to 3 inches away from the lubricated tip. And I will go ahead and place it through. So Mrs. Smith, I am ready to go ahead and insert the catheter. If you could go ahead and take a deep breath from me, and then on the exhale, I will go ahead and insert the catheter. Okay, so if you want to take that deep breath. Okay, we'll go ahead and insert. Once I do see a flash of urine, it will make sure to insert the catheter an additional 2 inches, which is 5 centimeters. All right, so I have gone ahead and seen a flash of urine, so I will make sure to enter about 2 more inches. All right, I will make sure to grasp the catheter with my non-dominant hand, and with my dominant hand, I will go ahead and grab the flesh and inflate the balloon. And I will go ahead and detach the syringe, the flesh, and dispose of that as well. With my non-dominant hand, I will go ahead and slightly pull on the catheter. Once I feel resistance, I will go ahead and stop. Okay, so I do feel some resistance, so we'll go ahead and stop that there. All right. So I am going to go ahead and take off the patient's perineal drape. Ms. Smith, I'm going to go ahead and dispose of the drape. I am going to go ahead and use that to wipe you off, so we'll touch you again. Right? And I will go ahead and remove the patient's catheter. Of all the items as well. And I will go ahead and dispose of all the items in the trash since it's no longer needed. And then with the catheter, I will go ahead and secure the catheter to the inside of the patient's thigh using a securement device. Right, Mrs. Smith, I'm going to go ahead and attach this tubing to your inner thigh, making sure to leave enough slack so that way there is no tugging. And then with your catheter bag, I am going to go ahead and place it right down here at the base of the bed on the frame, okay? And with the extra tubing, I can go ahead and clip that to the edge of the mattress. All right, Mrs. Smith. Okay, perfect. So we've gone ahead and left it that way. I do want to go ahead and let you know of just some precautions with your Foley catheter bag. If for any reason you do have to move, please go ahead and give me a call. We just want to make sure that you have assistance because the Foley catheter bag can be a little bit of a safety issue. Now, if for any reason you do feel that there is any tugging, there's no slack, please let us know as soon as possible. And also too, with the catheter bag, that should remain below your bladder at all times. So please make sure it's left in that position. I will go ahead and remove my gloves. Okay. I will go ahead and perform hand hygiene. I will make sure that the patient is left in an upright, comfortable position. I will go ahead and make sure that the patient's call light is left with them as well. I will then leave the room and document the procedure.